For the millions of people suffering from cancer, the diagnosis is often made worse by a type of severe pain. It's a pain so severe that even the strongest narcotics are no match, and very little help was available until now.
Thinking about when you experience pain, to try and remember it is hard, but at the time that I'm experiencing it, it's the most debilitating feeling in the world. And I start to panic. I can't cope when it starts to happen to me because of the fear of not being able to tolerate it. And that scares me. My name is Gina Adams. And in 2010, I was diagnosed with stage 3 colon cancer. I have 2 daughters, a freshman in college and a senior in college. And I've been married for 23 years to Daniel, my husband.
So when my mom's in pain, it's especially hard for her to even just like leave her bed or go out of her room or do anything but try to feel better. She hasn't been absent, but sometimes she can't attend things. It's hard to leave the house when you think, you might have a pain episode and you're gonna need to plan for that. She's very involved in my life and my sister's life, but you can tell that it's harder for her to be there in general.
Breakthrough cancer pain affects about 60% of all chronic cancer pain patients. The terminology is self-explanatory. What's more difficult to put into words is just how painful breakthrough cancer pain really is.
The pain would come on very, very suddenly. And I think the biggest thing about the pain was the anxiety that went along with it, because when I was starting to feel the pain episode come on, the anxiety of me not knowing if I was going to be able to get through it was debilitating, and it would add to the whole thing. I would start getting clammy and start getting, just very anxious and wondering how I was going to get through everything.
Joining me now is hematologist-oncologist Dr. Ashish Udhrain. Doctor, welcome to the show.
Thank you.
Why exactly does breakthrough cancer pain happen, and why does it happen for certain patients and not for others?
Breakthrough cancer pain is defined as sudden flare or burst or breakthrough of baseline patient pain that patients experience while taking pain medications.
And why does it happen?
Cancer pain can happen from chemotherapy causes certain types of pain, such as neuropathic or burning pain in your hands and feet. Cancer in and of itself, for example, invading into the bone can cause stabbing, sharp pains in your bones. So they can happen for a multitude of reasons for different types of cancers. Just being on baseline morphine or oxycodone or what have you does not eliminate that possibility.
Doctor, I understand that your experience with breakthrough cancer pain is not just clinical, it's actually personal. Can you tell us a bit about your story?
Sure. My mother was diagnosed with metastatic uterine cancer 4 years ago. The treatment that she received caused neuropathic pain, which is the burning, numbness, and tingling pain. She's had progressive bone pain associated with the disease. She would have these episodes of breakthrough cancer pain, which unfortunately just the medicines she was on was not controlling it well.
Right, and the pain is so intense that it actually breaks through some really powerful drugs like morphine and Percocet.
Yes.
Right, and this must leave your patients feeling so hopeless. Do they even go as far as to open up to their oncologist when this happmes to them? Patients
sometimes don't want to divulge symptoms or side effects to their doctors. Because they don't want the cancer treatment to stop. Mm-hmm. They're afraid that if they inform their doctor of too many side effects, that the treatment that may be working for their cancer may be stopped because of side effects. And to others, they feel that it's just a way of life. Right. That it comes with the whole package of having cancer, that this is how they have to survive, which is not true.
There is good news. You are here to spread awareness and give patients some information about a treatment that they might not know about.
It's true. There's a class of drugs called transmucosal immediate release fentanyl, or TIRF. This class of drugs can help eliminate breakthrough cancer pain a lot faster than what immediate release morphine can. They take as long as 45 minutes for them to take effect to work. So what's happening in that time is patients already had their sudden onset of debilitating breakthrough pain, and which may be over, that episode may be over before these other products have even a chance to work in their bodies. And the good thing about TERFs is that the relief of pain can occur as early as 5 minutes.
And that's a big deal when you're at your child's soccer game, or whether you're shopping, or when you're at work. You can't wait 40 minutes when you're feeling the pain at that moment.
Your quality of life, as well as your what we call performance status, gets affected. Why that's more relevant also in patients is because what us as cancer doctors use is a performance status to see whether or not patients can tolerate their cancer treatment. So if the patients become too debilitated, they cannot receive their cancer care.
Are we saying that these drugs are more powerful than morphine?
Fentanyl is about 100 times more potent than morphine. This is a reason why the patients who qualify to receive this medication need to be what we call opioid tolerant for them to tolerate this fentanyl.
And does it come in form of pills?
It comes in multiple different forms. It comes as what we call a buccal tablet, or the tablet that you put inside of your mouth. It comes as a buccal film, a lollipop, as well as a spray that you put under your tongue.
So, doctor, how significant is this breakthrough cancer pain treatment for those patients that are suffering largely in silence?
You know, Eric, it's very important because cancer has a very negative connotation in our society about it being a death sentence. And it's truly not the case, because it's truly becoming what we call a chronic disease. And because it's becoming a chronic disease, we have to deal with the symptoms associated with the disease and or the consequences from the treatments of the disease. And I tell my patients, you know, there is an option. I want my patients to live rather than to exist.
Right.
And with this drug class, we can truly get our patients to living their life again rather than have to suffer.
I hear you. So they're living their present and they're not living in fear. Thank you so much for bringing all of that awareness. I also want you viewers out there to hear how Gina's whole outlook changed after receiving this treatment.
Yesterday I started to feel like there was an episode coming on, so I went to sit in the bathtub so I could relax, so I could calm myself down. And so I called my older daughter and I said, go get me my medicine and set it in the bathroom so that I know that it's there. And just it being sitting there, I was able to, you know, it just made me feel more confident, like I was going to get through the situation. Now I can enjoy my family more. I can return to my normal life. And I can only spend a little bit of time on cancer and pain instead of a lot of time.
We have a lot more quality time together now that she can feel better. That makes me happy.
And again, if you are experiencing breakthrough cancer pain, don't suffer in silence. Talk to your oncologist. And of course, you can also log on to accesshealth.tv for more information.